I'm going to show you a few techniques you can do in the cervical spine to apply stretch and a little bit of joint mobilization. So let's say that maybe the patient's having a headache, or it's just neck pain or cervicogenic dysfunction, even dizziness related to the cervical spine. These techniques work well with that. So what I'm going to do is I'm cupping Lizzie's head just like this. I'm going underneath her neck, right at the base of her hairline, not an occiput, and I'm just pulling and I'm leaning back. Now I'm keeping my elbows as straight as I can for this kind of traction force, because if I keep my elbows bent, that's really going to work my biceps. So I'm going to pull straight back like this. I may side bend her. This depends if she's having radiating symptoms down the arm. So if she's having radiating symptoms down her right arm, I may not bend her towards the side that the symptoms are going on, but I would side bend, and I can go the other way, side bend this way. Then we can apply a traction and a depression of her shoulders. So I'm going to pull, have her cup just like this on her neck. So I'm coming under here. Be careful where your thumbs are. Don't want to squish the throat. And I'm going to push down on her shoulder at the same time I'm tractioning. That does really well at stretching out all the tissue on this lateral side of the neck, the SCM, the scalenes. And so you have to be careful though, because the brachial plexus does sit behind here, so we don't want to, compress or irritate those nerves. I'm just going to hold that traction force. You can even oscillate. So I've got her in a traction here, and I'm just oscillating just on a straight line of pull. Lean back here. Now it's a little difficult to oscillate with your elbows straight, so you may have to bend them a little bit for the oscillation. So I'm just oscillating there. I can rotate Lizzie's head at the same time and oscillate. And I do have her pull at a little bit of an upward angle while I'm doing this, but that doesn't necessarily matter. That's just preference and comfort of the patient. So those are a couple of techniques there that I really like. Now I'm going to show you also a technique we can do to incorporate the clavicles and the shoulder with the cervical spine. Now this technique, you have to be careful if the patient has vertebral artery insufficiency. We don't want to bring them into too much extension, but let's say that we've cleared that and she's safe to do that. So I've got Lizzie here. I have this pillow under her upper back. Her head's completely hanging off here. I'm just tractioning again. So I'm going to hold this traction force in a little bit of extension. I can side bend her in this position, in extension, just working on some stretching of this tissue in the front part, the anterior part of her neck, as well as in range loading a little bit some of the vertebrae. And my hands, when I'm doing this, I'm tractioning, I'm also pulling forward. So like a little bit of P to A on the vertebrae. So I'm pulling up and towards me. So I'm just kind of pulling up and towards me. And then we also can incorporate into this, so we can go from the neck and then go to the shoulders. So I go and I press down on both shoulders, really stretching out the ribs and the chest wall here, the anterior aspect. Then we can come in and do a little clavicle work. So of course, get permission from your patient first. I'm going to go on the clavicle. I'm going to take the hypothenar side of my hand and I'm going to push down on her clavicle, and I'm pushing down towards her opposite hip. At the same time, I have her head rotate in the same direction, and I'm tractioning with my left hand. So I have my left hand under that occiput area, and I'm pulling towards me, and I'm pushing down with her clavicle. I can oscillate this if I want, 15, 20 times, and then relax. So then after doing that technique, both with the clavicle and with the shoulders, I like to come back in, a little bit of traction, pull back. I do have her head and a little bit, neck and a little bit of extension here. I can straighten that out if I want, or I can just straight line pull it. Either way is fine. And I come in like that, and I'll hold that for a few seconds. And I like to finish out what I call a neck washout. So I just kind of take my hands and do this on the vertebrae a little bit, and then just reapply a little traction. And that kind of finishes that all out nicely. Hope this video helps either with your patient's neck pain that they're having or your neck pain that you're having. Please make sure you hit that like and subscribe button, and thanks again.